We are now live on Facebook, and we just want to greet our friends. We are excited to be with you guys. This is our first series, our first series, man. I am just super excited. I've been telling my friends that we are gonna be starting this series, this health talk series here live on Facebook. I hope you guys, you're gonna be joining us soon. And I'm just super excited, man. I'm not alone today. I'm with Dr. Majobe Zondo, my sister here. She is very passionate about health. And, I don't want to waste much of the time. But, before we dive into all of this, I just want to give just few minutes for her to tell us who is Dr. Majobe Zondo.
Thank you very much, Mr. Mavimbela. I'd like to greet all our Facebook friends and greet everyone in different platforms that you might be viewing us at. I'd like to thank you for the opportunity. I'm also very excited to be part of this health initiative, where basically we are going to talk about very important health matters. But to go back to your question, I am a medical doctor. I've been one for the past 15 years. I'm based in South Africa, in Mpangeni. I work as a general practitioner. I've got my own medical practice. I also work in the public sector, working in hospitals and clinics. And I am just basically passionate about health. And I think it goes back to why I chose this career. It was basically to see people healthier, happier. When you are healthy and you are able to contribute so much in society, so much in your family, and and I love the verse in John 10 verse 10, because I'm a Christian, that talks about Jesus, that he came for us to have more life and have it more abundantly. So I love seeing people with abundant health and with abundant life and enjoying their life and just basically doing what God has called them to do and enjoying their life. And so the different diseases that come in our lives basically does the opposite. It limits us in enjoying our life, and then we are not, like how God created us to be. So I'm really passionate, and one of my biggest highlights is to see my clients getting better and improving and really getting back to where they are best fruitful, and because of the interventions or whatever advice I've given them, and they put it in practice. So that really gives me joy. And I hope these talks that we're gonna do, for those who are listening, they will take notes and incorporate in their lives, and then have the benefits of actually doing what we will be advising them throughout the talks.
Wow. Thank you so much, Doc. This is an amazing experience for me, man. I'm sweating already. I'm sweating because I'm excited. Guys, you have no idea how excited I am. We've been like, trying to do this, and time has been doing its own thing, but finally we managed to do it. One of the things that Doc said, that healthy people contribute to society. I hope you got that already. She's throwing something to us, man. And these nuggets, I want us to take them. She said something as well. Take notes, good people. Yeah. And as I've said, we are starting a great series this week. And the name of our series that we are starting, it is called a Kidney Talk series. Okay, it is called a Kidney Talk series, and the Kidney Talk series is divided into 4 parts. We're going to divide it into 4 parts. Today we're going to be looking at, introduction to kidney. I mean, I don't even know what's a kidney. The doctor is going to tell us what is a kidney. Maybe you've been hearing people saying to you, you've got kidney this, kidney that, There are many kidneys I've been hearing, Doc. So I don't know. So today she's going to tell us exactly what is a kidney and just basic information about kidney and its function and so on. And the second session, we will be covering the diseased kidney. Not today. That's the second session where Doc will be covering the causes, signs and symptoms, all of that stuff. And then the third session, you don't want to miss this one here, guys. Treatment of kidney disease, right? Because no one is immune. Anyone can get it, guys. I just want you to know that, to remember that. And the fourth part is the most important one. How a healthy lifestyle can help you to treat a diseased kidney. So you do not want to miss this series. You can see, man, it is packed. So I don't want to waste much of your time. Let me just hand it over to Doc and take us through the introduction of a kidney. What is a kidney, Doc? Over to you.
Okay, thank you very much. So, Mavimbela, I just want our audience to know they are welcome to send questions. We obviously don't want to be talking to ourselves only. You want them to interact, and they are welcome to send questions. If we're not able to answer them today, definitely on the next session. I like the fact that we're going to have different sessions. And so it's important that at the end of the day, these sessions are going to help someone and improve their life. So a kidney, very important. There are organs in the body that we call them vital organs, and the kidney is one of them. So vital organs are those organs that when they fail or they are sick, their body basically do not cope without them. So one can have a skin problem, or one can have a nose problem, or you can have an eye problem, but somehow your body can cope. But once you start having a heart problem or a liver problem or a kidney problem, which is what we're going to be talking about, then your body is not able to function. And worse, when it comes to failure. So when you talk about heart failure, liver failure, kidney failure, that's when things really get serious. And that's when if interventions are not done, one can lose their lives. So that's how important this topic is with regards to kidneys. So without further ado, I like your question. What is the kidney? So basically, this is and one of the vital organ, like I said, and it's basically an organ that is situated in the abdominal cavity. We have 2 kidneys, one on the left, one on the right. The right one is slightly lower because of the liver that sits above it. Most people actually, but I think the kidney is down. I find it very interesting because my patient will come to me and say, I've got a kidney problem. And then they will be pointing at different areas. My kidney, they'll point at their pelvis, they point at their abdomen, And then I know from there, when they say I've got a kidney problem, there's pain down there, I know that that's not a kidney. So where exactly are they located? They are basically located at, you call it a retroperitoneal area. They are at the back. So yes, at the back, just on the sides of your spine, just below the ribs, above your waistline. So they are right at the back, and they are not in front or down at the pelvis. And they basically, most people in a normal situation have two kidneys, but there are people who are born with maybe one kidney. But what we need to know is one can actually live with one kidney. That's why one is able to donate a kidney and still live after donation of a kidney. Or if you've had a problem with one kidney, say you've had a cancer that affects one kidney, it can be removed, or you've had an accident and it shattered the one kidney, it can be removed and you can still function on the one, which is really, I think for me, one of God's greatest miracle, that one has a chance. If you lose one, then you can you use the other. And if somebody is really in dire need of a kidney, they have serious kidney failure and dialysis no longer working, or they're waiting on a kidney donation who is on dialysis, I, as a normal healthy person and who can be a donor and save somebody's life. So we have two, but we can definitely function with one. So the
Okay,
most,
Doc.
yes,
Sorry, you have to excuse me here. You touched on something here,
yeah,
and I'm one of those people who always thought that the kidneys were in front, and I always touch, you know, when I'm saying, hey, I'm having kidney pain, I'll be touching here, and I've even heard of terms like kidney stones and all of those things. Maybe it might be a different topic altogether. But
yeah.
my question, I just wanted to you to touch on that part where you said one can live with one kidney, and how easy it is to get a kidney donor, and what age can someone. The reason I'm asking this question is I saw some stats which were a bit scary about the donors, but short, Doc.
Yeah. So first of all, it's very important to take care of your kidneys, because sometimes, you know, we have this notion that, oh, okay, if I'm in trouble, I can always get a kidney. Somebody will donate. So what I want us to take from this talk is treat your kidneys as a treasure, because once they have failed, it's very difficult to get a donor. And if you do get a donor, the process of the kidney transplant, it's a long process to make sure that you are compatible, and to make sure that, you know, there's no complications after, and going through the process is very draining. So the best way I would advise us is to make sure that we protect our kidneys, we treat them as treasure, so that we don't end up in the waiting list, waiting to have a donor, because those are quite few. And you know, in our society, most people are not really keen on organ donation. They still need to be a lot of education around the topic, and there still needs to be a lot of awareness around the topic. And those that are keen, you'll find that they are not compatible. So maybe you want to donate your kidney to a relative and find that you are not really compatible. So I want us to shy away from the notion that, hey, there's two kidneys, everybody's walking around with two kidneys. If I'm in trouble, they can just easily donate.
Okay, thanks, Doc. You've answered
Yeah.
that very well. Yes, you can continue, Doc. Yes.
Okay, so if you can allow me to stand just to show you the anatomy. Sorry, I'm gonna be shaking a bit.
Mhm.
So it's basically at the back, right about there. Okay, right about there. That's where they are. Um, and
Not
they
below the
are your,
belly button.
sorry?
Not below the belly button.
No, not below the belly button. It's not in front.
Oh,
They're at the back,
Mavimbela. Okay,
right
then.
about
Thank
there.
you so much. I'm not the only one, though. Thank you so much.
Yeah, I know. Most of my patients will point in very odd anatomical sites, saying my kidney is giving me problems. But we know now, as we talk now in this series, that there are retroperitoneal organs just at the back, at the lumbar area, and they're basically the size of your fist. So, but they basically, if you hold your fist, that's the size of your kidney, and they are shaped like a bean in terms of the shape. And for the females, it's the size is about 115 grams, and for the males, it's about 125 grams. So if you look at this diagram, you can see this structure of a human being facing the back is basically on our side, and they are located at the back where I just demonstrated earlier on.
Wow.
Yeah, so in terms of the measurements, so we say in terms of weight of size, the size of the fist, and for the male, it's about 125 to 175 grams. For us as women, slightly smaller, because obviously even our fists are slightly smaller. And they measure about 11 to 14 centimeters in length, and in width, they're about 6 centimeters. And they're about 4 centimeters thick. So you can now imagine that bean-shaped sized organ with those dimensions. And then in terms of the structure, they basically sit with organs surrounding them. We said the right kidney is slightly lower than the left because there's a liver above. They are protected by fats around, there are muscles around, and there's also ribs at the back to protect. And and then there's also, we know it's basically because it's a vital organ, God made us so wonderful that all our vital organs are well protected. If you think about the brain, your skull is so hard.
Yeah.
If you fall, it doesn't just immediately affect the brain. It has to go through the thick skull. The heart and the lungs are also protected by the rib cage, and also the kidney and the liver. To a certain degree, the liver is protected by the rib cage and the kidneys as well. In terms of the structure, it's very important how they function. So every organ needs blood supply, nerve supply, lymphatic drainage. So even with the kidney, there is an area called the hilum where the vessels go in and the arteries and the veins go out, and there's nerve supply and lymphatic drainage. That's very critical for the kidneys function. And then what is very important that I want to depict on this diagram is we focusing on the kidney, which is that bean-shaped structure that we just described, just below the liver, as you can see, and it's got the veins coming out. It's got the artery in red feeding it the well nourishing oxygenated blood. And then in terms of the urinary system, so the kidney is an organ, but it is functions as part of the system. So God has created organs, and then these organs form a system. Different organs form the system. So when we talk about the kidney, we cannot just talk about the kidney and not touch on the urinary system. So we have the kidney doing its functions, which we're gonna talk about later. And one of its most important function is what we call fluid balance, where it regulates the fluid and produces the urine. It absorbs the electrolytes and control the electrolytes. And basically, we have urine production. And this is why the kidney is so important for water balance. If your kidneys are not functioning well, one of the symptoms you'll have is that you will have fluid retention, because the kidney filters a lot of fluid, retains what needs to be retained, and then excretes what needs to be excreted. So if it's sick, the body has to find other way to balance the water in the system. And one of the ways that one can see that there's something not right with the kidneys is when they retain the fluid and they become what you call Ureters, where there's fluid retention. But we'll talk about the symptoms and the signs of kidney disease. But for now, talking about the urinary system, Mavimbela, you can see that the kidney has got that yellow part going down there. That is when the urine is basically formed there, and what is not needed by the body goes out in those pipes. Those are the ureters.
Okay.
The ureters. You mentioned stones, kidney stones. So this is where most of the problem would come in. If you have kidney stones passing through the ureter, if they are big, they might be blocked here, and then someone who might come with very severe pain because there's kidney stones, and only in that case can they maybe point in the abdomen. But even if you point here in the abdomen, it's not your kidney, because you know that the kidney is up there. It's one of the products that's come out of the kidney. And we'll talk about stones when we talk about a diseased kidney. So the ureters basically collect the urine, and they collect it down to your bladder. Your bladder is a muscular organ that will hold the urine until you have a suitable, conducive environment to void or urinate. So we drink water all the time, and our kidneys are constantly filtering a lot of fluid. We've got about 6 liters, and in any given moment, about a third of that fluid is going through the kidneys. So then the excreted water, which is now called urine, will come down to your bladder, and it will be stored there until you are able, at your convenience, obviously, void or urinate. So this is now the urinary system. The kidney.
Can I just interrupt you there? Because you just said something which really interests me, and I've always wondered about this, and I'm sure some of the viewers are asking themselves this question about the bladder and the kidney. Is it just it's just me, or it's just my mental state that when I want to urinate, I cannot just urinate anywhere, but once I'm in the bathroom, it's like I cannot hold it. It just want to dash out. But I was holding it all along. So what chemistry there? Is it a mind thing, or is just between these two guys, they are working together? Maybe just if you can enlighten us there.
Yeah, it's a combination of the mind and basically the nerves.
Okay.
Because remember, we said the kidney has got the hilum. It's got where basically you've got the nerves, you've got the lymphatic drainage, you've got the arteries going in and out. But it's also got a very important system, which is basically the nervous system the nerves which are basically supplying the nervous supply here. So when your urine is formed and it's in the bladder, like I said, it's a muscular organ, and it can stretch significantly to hold your urine. And obviously, when it stretches, the functioning bladder has got a sphincter, and the sphincter is like your it's like a tap that can close tightly. And that sphincter can only relax when your nerves have basically given a message that it can relax now. You are in the right place to void. Okay. So it's more of a nervous system, your brain and your nerves communicating with your bladder in terms of the muscle. Because remember, your muscles are basically contracting and relaxing as the nerves are giving the message from your brain. That is why if somebody has got an accident, maybe like a bike accident, and they injured their back, and their lower limbs are paralyzed, we call them paraplegic, they are unable to control their sphincter. They mostly will need to have a catheter or maybe wear a diaper, because there's a discommunication, or there's no more communication between the brain and the nerves that supply the bladder to say, hold on, hold on, hold on. And then when you're in the toilet, okay, now you can release. You see? So basically that nervous system communicating with your muscular system and the sphincter releasing and then opening up.
So thank you, Doc, which brings me to my second question then. Is it then a good thing to hold it for long? I will say this because I'm a runner. You know, sometimes when I'm running my my marathon or my race or whatever, I hate to, you know, they have sometimes, especially if you are doing, you know, a long distance running, like your 42Ks, you know, your 90Ks and all of that. They have toilets on the road where they will say, okay, for runners, you can always go there.
Yeah.
Sometimes as runners, we find that, no, I'm wasting time. By going there, I'm wasting time. Let me hold it. So my question is that a good thing? Is that a good health practice? Because remember, as runners, we drink a lot of water when we are running.
Yeah. Yeah.
It's a good practice to hold it.
So no, it's not a good practice to hold it for too long. Okay. You can hold it, but it's not a good practice to hold it for too long. So obviously, you know your system, the body. It's very important, Mavimbela, to listen to our body. So when your body says you need to void, obviously it's nice when you can be able to hold it for some minutes, because it's inconvenient. Because if you were needing to void and you need to void now, then it's also a problem, because there are times when it's inconvenient to be able to go to the loo, or there are no loos or toilets. But if you hold it for long, then the bladder really gets very distended and it's stretched. If it's stretched to the limit, you can have actually backflow of urine. So you know the flow is going down. So if the bladder is stretched for so long and there's overflow, you can have the backflow of urine back to the ureters, which is something that you don't want to happen. In fact, for most males who have prostate problems, the prostate basically, as we know, is a gland that is down there, around at the base of the bladder, circling the urethra. So if the prostate is enlarged, this can cause the bladder to be overfilled, because it's difficult to urinate. And then when the bladder is overflowing with urine, this can cause backflow to the ureters. And the ureters can swell up, called hydroureters, and the backflow can eventually actually affect your kidneys, and you can have a kidney problem based on the backflow of your urine. So under normal circumstances, you must know a threshold whereby I need to go. Don't try to hold it in too long unnecessarily. So I know you're trying to win a race, that's okay. But if you hold it too long, then you're not doing your bladder or your kidneys or your ureter, that urinary system, you're not doing it a favor.
No, Doc, you said it very well. Continue, Doc, before I interject again.
Okay, so basically that's the urinary system. Basically your kidney, your ureters, the bladder, and then the urethra, and that's basically how the urine is formed and how it flows out. But our talk is basically on the kidney, and so I'd like us to take a closer look at the kidney. So now we've seen the kidney, that bean-shaped organ. We're now taking a closer look. It's like you take the bean and you cut it into half, and we're taking a section and we're looking closer. If you cut the bean in half, it's no longer like that brown bean that's got a capsule. Now you cut it into half and you want to see what's happening inside the bean. This is basically it. It's got that capsule, which is the outside cover of the kidney. We call it the renal capsule. And then there is a cortex, and then which is the outer parts of the kidney. And then inside is the medullary pyramids. So I'm not going to bore you with physiology because it's really, a kidney is very complicated.
Okay.
If you were to go to the nitty-gritties of the kidney, I might take a long time and also maybe confuse others. So if you have interest, you can contact me privately, but also you can find out more of these structures. But basically, in the medullary pyramid, that's where the function happens. You've got what you call a nephron, which consists of the glomerulus, and then there is blood in thin small vessels coming into the glomerulus, and then there's filtering, and then there's tubules, and there's absorption, reabsorption in the collecting ducts or loop of hand, let's call them, descending, ascending. There's a lot of things basically that are happening there. But basically what's happening is there's fluid homeostasis, fluid balance. What do we need to absorb? What do we need to reabsorb? What do we need to excrete? That is the function of the kidney. And finally, this will collect in the renal column in that area called the calyx, and then eventually all these calyxes, different calyxes, as you can see, it's like, almost like your fingers collecting into your hand. So the renal calyxes will collect like into your hand, into a renal pelvis, and then your renal pelvis will now come to this one ureter, which we spoke about, that is now draining the urine from the calyxes, and this is now your kidney, basically. So this is the kidney that we've cut into half, and we've seen that when we cut into half, it's got all these calyxes that collect into a renal pelvis, and this now comes to a ureter, and that's where your urine is now gonna go down to the bladder. Okay, so that's basically the structure of the kidney in a more detailed view. But obviously, it's not as simple as I made it. But I hope it sort of like makes sense. So this is basically what is happening to us as we sit, as we sleep. Our kidneys are constantly working, constantly making sure that our fluid balance is perfect. The electrolytes are perfect. They are constantly making sure that toxins are being eliminated, and constantly making sure that there is good balance in terms of the hormones. So that those hormones also regulate the blood pressure. Those hormones also regulates your other function, like your red blood cells production, the erythropoietin. There's a lot of kidney function that is always happening at the kidney. And that is why when the kidney gives away or is sick, there's a lot that of symptoms and sickness that one would exhibit. Because unlike the eye, when it's sick, it's like, okay, I can't see. But with the kidney, because it's got so many functions, there's a lot that can go wrong. And when that goes wrong, it immediately also affects other organs. And then you then have this multi-organ failure, which was originally because the kidney has not been functioning well.
Okay, Doc. Just before you move on, now you are coming to a kidney functioning.
Yeah.
I wanted to ask you something there. You spoke about that hand stuff. It's very interesting. I was picturing it, and you explained very well to me. I mean, I just wanted to know, as we grow older, does it get affected? And does our lifestyle also maybe have any effect in it? That balancing of electrolytes and so on, all those things, our age and our health. Does it play any part there?
Okay, so yes, just like any other organ, as we grow older, the functions, it's like, your wear and tear. When you've got a car and you've got the tires that have been on the road for the past 2 years, we know what happens to those tires. So even with us, as we grow older, all our system basically decline in function, and the kidney is also not immune to decline in function because of age. So if you take a healthy 20-year-old and compare their kidney function with the 80-year-old, we will talk about the GFR, which is your glomerular filtration rate. The one for the younger is usually higher, above 90, and the one for the older might be lower, maybe below 60. And it could be just purely because of age, because the kidneys have been working 24 hours, 7 days a week for 8 years, you understand? And
Yeah.
then also, because the older we become, we have diseases that come into play. Top on the list is diabetes, top on the list is hypertension. All these diseases will affect the kidney negatively. And also, we also have habits. You talked about it, lifestyle. Top on the list is smoking. Smoking will affect your kidney function because it affects the vessels that supply oxygen to your kidneys. And when that happens, then the perfusion is poor, the delivery of oxygen is poor, and then you can have kidney problem basically because your blood pressure is not well controlled over years, diabetes is not well controlled over years, and you have vascular damage because of the smoking, which is a lifestyle issue. So yes, age affects your kidney function, and also lifestyle diseases and lifestyle choices can also affect your kidney function. So it's good news because there's something that one can do to avoid declining kidney function, and there's something that one can also be empowered so that at the end of the day you have better functioning kidneys for longer. Because we only have 2 guys, and for systemic diseases, so any disease that affects your system, it affects both. It's unlike when you have, say for example, you've got involved in a car accident and you were hit mostly on the right, so your right kidney got damaged, and then they decide to take it out, you still have your left kidney. But for systemic diseases, your hypertension, your diabetes, those affect both kidneys. You can't say, oh, my diabetes just affected the right, I still have the left. So it's even more important when you have got a disease that you're living with to make sure that it's well controlled. Speak to your doctor about it and make sure it's well controlled so that your kidneys are not affected by it. If they are, it's only a progression that is slow that can take you to 80, 85, whatever age that God has blessed you with.
No, Doc, you said a mouthful there. You know, I'm sweating right now, and I'm thinking when you said these systematic diseases, the way you put it, you know, in your medical terms, it doesn't affect just one. It can just go for both of them. So now this brings me to the fact that, guys, it's all about taking care of ourselves. And I think anyone who is listening to us today, who will be following us, they should be, I mean, they are very blessed to have such information, you know, because here it's all about healthy lifestyle. And when you said that there is something that can be done, this is what can be done. Listening to such talks as these, you know, when we have doctors trying to, you know, give us all the information, guys, you know, Doc, I am sweating, you know, with the information that you just gave us. I mean, I'm scared. I'm even asking myself, am I doing enough? You know, so that's the question I'm asking myself right now. But let me allow you to continue, Doc, before I disturb you.
Okay. Well, I hope the talk is not to make you scared. I'd like to think of this talk as a challenging you, challenging you to find more about this wonderful organ, challenging you to basically find ways of taking care of this wonderful organ. The biggest disclaimer that I should have said in the beginning is these talks that we're going to be doing are not meant to treat or diagnose anyone. So please do go to your doctor, have yourself checked out, have yourself properly tested, diagnosed, and have yourself on the right treatment. But in general, if you apply these things that we're going to talk about in your life, it will only serve to enhance your life for the better. But we all need our medical doctors to take good care of us as individuals, because this virtual platform cannot do that on a one-on-one basis, and individualized treatment is what you need to have with your doctor. So basically, going back to our talk, we've mentioned this basically the kidney function before, but I just want to go through them. So they remove waste products, the what the body doesn't need, like the urea, and also the medicines in the body. You know, some of us are on chronic medication, and those medication have got what's you call waste products or metabolites that need to be removed from the body. So the kidney is very useful in that. It's also very important, as we talk about medicine, not to unnecessarily use medicine that will be harmful to your body. So we'll talk about specific drugs that one needs to avoid, because sometimes we get so used to just taking certain medication over the counter, even for minor illness or minor ailments, and then we unknowingly so we are putting what's it called? We are taxing our kidneys or putting a strain on our kidneys. So it also balances the body's fluid, like we said when we're talking about how the urine is formed and how the fluid is reabsorbed and absorbed and all so forth. It's very also a good indicator of your fluid status to look at the color of your urine. So if your urine is very concentrated, it's almost orange or very strong yellow and it's got an odor, you must know that you are running behind fluids. So you need to hydrate yourself, because your kidneys are basically saying, we can't let go of this water. Let's reabsorb it because we are very dry here. So, and then what comes out in your urine is concentrated, it smells, and it's a strong color. If you see that in your urine, it's an easy indication, drink more water. So your urine should be pale yellow. If you are really an average drinker of water, your urine will probably be clear. So it's very important to help our kidneys to function better. They need water. But water that is over-consumed when you have a kidney problem is also a problem. Because remember, when you start having a kidney problem, your kidneys are not coping. They are not able to balance the fluid. The homeostasis is lost. So you need to also to be speaking to your doctor, how much of this can I eat? How much of this can I drink? So that you do not tax your kidneys too much. But in general, for us who are still healthy and who don't have any problem, we need to be at least drinking about 6 to 8 liters, eight glasses of water, up to 2 liters. If you are very sports orientated and you are very active, you're probably going to be needing more. If it's very hot weather, you're going to be needing more. But your good indication of how well hydrated you are, look at your urine. So don't just do the business and flush.
Yeah.
What you do there is a good indicator. What's going inside, what you take out is a good indicator of what's happening inside. Even with your number 2, with your excretion now, what you take out there is a good indication of what's happening inside. Obviously, we'll talk about that another day. So it also controls your blood pressure. Your kidney is basically got a hormonal function as well. There's a renin-angiotensin system, so it can make your arteries contract or relax. So your blood pressure can be controlled. It affects the blood pressure control. That's why even the hypertension tablets that we use, some of them are working on this system, the renin-angiotensin system. And also there's a hormone called erythropoietin. So this hormone basically helps with more red blood cell production. So someone that's got a kidney problem that's long-standing, one of the symptoms they will have is they'll have anemia, which means your blood is weak or your hemoglobin is weak, because the erythropoietin that's produced in the liver is no longer produced, and this causes the red blood cells not to be produced well in the bone marrow, and the drop in their hemoglobin will cause one to have anemia, and anemia will manifest as, I'm just tired. One of the most common kidney symptoms is, I'm just tired. I don't know what's wrong. I'm tired. If you are constantly tired, constantly feeling drained, see your doctor. They will do your blood sugar, your blood pressure, but they must also test your urine, test your blood test for kidney function, because the important thing about kidney disease, it usually manifests late. So it's important to, when you have symptoms that are strange, see your doctor, have the test done. Don't wait until you really are now on a wheelchair and you are being taken by a relative to see the doctor, because they don't manifest early. The the kidney failure will not manifest early, but the symptoms will be there early. So if you can pick up on the symptoms and go to have the test early, one can actually stop the kidney damage depending on the cause, because the causes are different, which is what we're going to be looking at in our next session. So obviously, it's also control your calcium, your phosphorus, the electrolyte, different electrolyte, the sodium, potassium, very important. And this is basically what we spoke about earlier on, just more few pointers. And as we're coming to a close, Mavimbela, I love to speak about what can we do? Because most of the diseases, what I've realized with my clients, when they realize they've got a disease in this specific topic that you're talking about, if got a kidney disease, it's like, okay, obviously one feels nervous and in despair, and they're like, okay, it's over to the doctors. What can the doctor do? What can the doctor do? Help me, doctor. Help me, doctor. So what I'd like us to speak about before we close, I close this presentation, we're obviously going to talk, if your time allows, is what can you do to prevent chronic kidney disease, to prevent your kidney getting sick? Because there's so much that is in our hands, in our power to do, but that we often will not do. And when we are in trouble, even then we have a window to actually do. Most people will still not do, just wait for their doctors. Give me the tablets, give me the injection, and let's operate. But what about, what can you do? So this talks to that. What can you do to prevent kidney disease, especially chronic kidney disease? So chronic is long time, it's 3 months and over that you've had this kidney problem. And it's obviously also in stages, which we're going to talk about. But we want to prevent even stage 1 kidney failure or stage 1 kidney disease. So we spoke about lifestyle. Please stop smoking. If you're smoking, please stop smoking. You will do not just your kidney. I know with smoking, we usually speak about the lungs will thank you for it. But today, the kidneys will also thank you for it. The heart will also thank you for it. The brain will thank you for it. So all your vital organs basically will thank you for stopping smoking. Because when you stop smoking, the damage that's happening at the arterial level, where your arteries are being damaged, will stop. And when your arterioles are being damaged, your vital organs can be perfused better, including the kidney. So stop smoking if you are. If you have been thinking about starting to smoke, don't. Okay. Then secondly, reduce salt intake. So sodium is basically one of the electrolytes that is regulated in the kidney. So if you take too much of sodium, this obviously would overtax the kidney. So if you have a high salt intake diet, this will put a strain on the kidney. But not only will it help you to reduce salt intake, it will also help you manage or control your blood pressure. Because remember, we talked about diabetes and hypertension being one of the diseases that will affect your kidney negatively if they are poorly controlled. So hypertension, if you take too much salt in your diet, is poorly controlled if you have a high salt intake diet. So when you control your salt intake and you reduce it, this improve your blood pressure control. In turn, this protects your kidney. Normal blood pressure protects your kidneys. So please, no more salt shakers on your table, and make sure that when you cook your low salt diet is maintained basically. So eat also healthy, mainly your fruits and vegetables, mainly because your protein has got a lot of urea when it's broken down, and all those are very taxing to the kidney. So if you want to go on a kidney protective diet, which we will speak about in our last session in details, fruits and vegetables is the way to go, and avoid your heavily taxing meals like your meat. Exercise regularly. Sorry, I'm trying to get to exercise regularly. So to maintain a healthy weight. So basically, when you exercise, we know our vessels open up. There's more blood perfusion to all our vital organs. The vital organs are happy. There's more oxygen coming in. More oxygen coming in, the healthier they are, they can do their function. So when you exercise, it's not just because you want to lose weight. It's also because your heart and your kidney will thank you for it, because there's going to be better perfusion. And also, obviously, you must control those two diseases that you spoke about, your diabetes and your blood pressure. I always say to my clients, you must know your numbers, know what is your BP numbers are sitting at. Normally, it's 120, the top number over 80. But you can go up to 130, 139, over 80, 89. Anything above the top number of 140, the bottom number above 90 is a cause for concern, because that's when those microvasculars are being affected. And your blood sugar obviously needs to be controlled. If you have those conditions, make sure that they are well controlled. Speak to your doctor, have tests that show these two conditions are well controlled. In fact, if you have these two conditions, your doctor should be doing kidney function tests every 6 months. They should be checking your urine, making sure that you don't have things in your urine, such as proteins that shouldn't be on your urine. So very important to take home and make sure that we also are on the we are on in control about the things that we can make a difference. Okay, so
Wow.
and as I close, I know you've got questions. I'm gonna ask you. I hope you know now what is a kidney and what shape is the kidney. I hope you know where is your kidneys and the basic function of the kidney, and basically what is it that you can do to preserve those kidney function, which is the slide that you just spoke about. But yes, basically, today's talk is just about that, talking about the normal kidney and tackling those few questions that I hope now when somebody speaks about the kidney and they point somewhere, you can say, no, it's not there.
Wow. Doc, this was, mouthful, more than mouthful itself, man. You just given us, a real treasure. Because I always say that health is wealth. Because
Yes.
without health, you cannot work. No matter how much you want to do things, if you're not healthy, you cannot do anything. Hence, I was listening to someone when this person said being sick is costly. He was not just talking about paying hospital bills, but this person was saying being sick, it can cost your whole life. And I love what you just said, that there are things that we can do. Just before I let you go, Doc, maybe you can touch on this. I've always heard people saying protein. Every time you talk to people about health, healthy lifestyle, they will say, no, I need my protein. How important it is to know how much protein you need to take. I know you touched on that, but maybe if you can just emphasize, because every time you talk to people, it's like protein is one of the most important thing in food or in health. How important it is to know how much protein you need to take.
Okay, so it's important, but remember, if your body is functioning normally, it can actually, you're talking about the kidney, it can cope very well with your protein intake. It can eliminate toxins, it can do the functions very well. So obviously also the source of protein is important, because we get proteins from meat, we get protein from beans. Your vegetables have also got proteins, and they are good sources of protein. But the vegetable source of proteins are, the body can easily manage with those. But when it comes to meat, that can be a bit of a problem, and that's where your dietitian or your nutritional advisor should come in to say, okay, you weigh so much on the scale, you have chronic kidney disease stage 4, because stage 4 versus stage 1 is different. And the diet for somebody that is on stage 4 is very stringent and very strict, because now we are now on dialysis, we now probably waiting for a kidney. So you can't be playing around there. So in terms of how much, it's good to have a nutritional advisor or your dietitian working with you in terms of your weight, in terms of what stage of a kidney disease you are at, and obviously calculating your daily protein requirements, because we have your daily requirements for most of the things that we eat. But in general, your kidney is able to cope with proteins in a healthy form. I personally advise most people, my clients basically, that you should shy away from animal protein, like everyday meat, every day, like every day. And so you must shy away from those. Try to have them once a week, or not so heavy. There are some people that when they need to sit down for a meal, it's not a meal unless it's got meat,
Yeah.
and that is a big problem, because as we know, originally the diet that we were given back in the Garden of Eden did not consist. It's only after things went wrong that it consisted of meat. And so it's not ideal, but our body in a healthy state can deal with it. So, but when we're now tapping over to a disease state, then we need to be very careful, and we need to be consulting the relevant people to work out how much is safe for me and how much is not safe, what sources that are safe for me, what sources are not safe for me to take for my protein intake.
Wow. Well said, Doc. I think our viewers are excited as I am, and I do believe that next time we'll have more viewers, more people listening to this talk, and I hope that what I love about what I really love about Facebook is that this is going to stay there, even when we are no longer here on this end. This information will still be there. It will be helping others, because that's the main aim of this whole ministry. So we are trying to make people aware. And thank you, Doc, for that disclaimer that you did, that here we are not trying to diagnose anyone, and we are also not trying to give you a quick fix. And I love what you always mentioning this. See your doctor. See your doctor. As a doctor yourself, maybe I was thinking you're gonna say, I'm a doctor. What I already told you goes. But no, you did not say that. You kept on saying you have to consult with your doctor. You have to consult with your doctor so that they can do a thorough check. Doc, You know, I'd like to say thank you for all what you have done. Looking forward to our next session. I cannot wait. Just to remind our viewers that our next session will be the diseased kidney. So now we're going to be talking about that diseased kidney. Now that you know what is a kidney, hey guys, we know where the kidney is now. Stop pointing, you know, below your belly, guys. Come on now. Don't embarrass me now. The doctor has told us. I'm just kidding with you guys. This was an amazing information, man. Thank you so much, Doc. May God richly bless you. For me, I'm super excited, and I will be digesting this. I'll be going back to this live, you know, streaming, listening to you, because what you've just given us is just super amazing. Allow me to release you so that you can go and rest with the family. And guys, let's just all put a big round of applause for Dr. Zondo, for her, you know, she just giving herself to us and say, guys, I'm here. I'm giving myself out to you. All the way from South Africa, and I'm all the way in Dubai. We are doing this together through technology. Make sure that next week you are here with us. We will, you know what, Doc, we're going to be doing now? We will be sending posters or flyers so that people will know when we are online. So watch the space, guys. We will be telling you when we'll be online so that you do not miss this. And we love you. Peace out. We will be shutting down. And bye for now, guys, online. We really appreciate you. Till we meet again. Thank you.